In this video, we're going to talk about symptoms related to the cardiovascular system and the chest overall. Let's start with heart palpitations. Heart palpitations, we want to know, are they fast? Are they intense? We want to know if they're irregular or regular. We want to know if you feel a sudden beat and then it stops, or if you feel a constant going. We want to know what triggers it. Does it happen more when you're ascending stairs, when you're descending stairs, when you're going from sitting to standing, when you're going from standing to sitting? Does it happen only with anxiety or or rage? We want to know if anything makes it better or worse. If there's a time of day, the typical stuff that we want to see related to any symptom. This is also an area where we feel an awful lot of emotions. So let's shift gears and talk a little bit about emotional sensations in the chest. Dr. Petersons, do you want to cover that?
Yeah, so a lot of people will have with any emotion, but anxiety or anger, and sensation of a racing heart. I always like to ask, does your heart rate actually raise? Do we have an increased heart rate, or is it just the sensation that our heart is racing? Two different symptoms and good to differentiate between. And then, just different pains or pings or sensations in the chest, or heaviness in the chest, or feeling like an elephant is sitting on your chest, or something is squeezing around your heart. Those types of descriptors can be really helpful and characteristic.
Absolutely. And when it comes to chest, we always think about POTS, right? So postural orthostatic tachycardia syndrome. So that's where you have that sitting to standing type of increase in heart rate. And so this is something that could be talked about, but we want to talk about the symptoms associated with it and not just talk about POTS. And there is a pretty strong correlation between, we say pots and pans, right? So there's the people have pots and pans, and just saying, oh, my POTS is acting up, what specifically is acting up? Is it lightheadedness? Is it, and what does that feel like? And go back to our video on the nervous system to get more details about how to describe lightheadedness versus vertigo versus other symptoms that are similar. So talk about the symptoms themselves rather than just saying POTS. Is there anything that you wanted to add to that, Dr. Petersons?
Yeah, like, do you get Raynaud's or loss of circulation or numbness or tingling with your change of position, change in skin color, swelling in the extremities, sensations in your blood vessels? Sometimes there's burning or throbbing or a feeling of dilation. Those are the symptoms of POTS that are really useful and kind of revolve around the cardiovascular symptom. But just POTS by itself doesn't tell us a lot, because there's so many different displays, just like in PANS,
right,
that it tells you more to give us the different symptoms.
And there's going to be some aspects of on the next video that will be relevant for POTS as well. So if POTS turned your attention up, check out our next video on thermoregulation, perspiration, and fevers.